I want to welcome everybody to our March SC chat, where today we're going to be talking about telepractice versus in-person service coordination. People call telepractice all different things, particularly if you are joining us from other states. Teleintervention, telehealth, tele something, but we're glad you're joining, and that's what we're going to be talking about today. So let me go ahead and introduce our presenters. We are delighted to have three service coordinators from the Infant and Toddler Connection of Fairfax Falls Church. And Adriana, would you please get us started?
Sure. Good afternoon, everyone. Adriana Gallego. I'm the Director of Service Coordination for the Infant and Toddler Connection of Fairfax Falls Church. I have been involved with early intervention, for the past 19 years. A long time.
Thanks, Adriana. Hooray.
Yes. Hi, everybody. My name is Harena. I'm a service coordinator, also from ITC Fairfax Falls Church. Come April, it'll be 5 years that I started working as a service coordinator, so time definitely flies.
Thanks, Hooray. And Blanca.
Hi, everyone. My name is Blanca Siles, and I am also a service coordinator with the ITC Early Intervention Program in Fairfax. And I have worked as a service coordinator in early intervention for a little over 7 years now, and with children and families in early childhood for more than 12.
Thanks, Blanca. And I'm Corey Hill. I work at the Partnership for People with Disabilities at Virginia Commonwealth University, and I oversee the comprehensive system of personnel development. So any professional development for early interventionists in Virginia. So thanks for joining us. We're going to go ahead and get started. We'd like to find out a little bit about you. What I'd like to ask you is type in chat just the number of years, how long you've been a service coordinator, and are you a blended or a dedicated service coordinator? If those terms are unfamiliar, blended means you might have two roles. You might be a special instructor and a service coordinator, or a physical therapist and a service coordinator. A dedicated service coordinator, that's your whole job. So thanks. It looks like people are getting us started. Donna Baldwin has been here 20 years. Hey, Donna, 6 years. Emily Sales is blended, dedicated, nice mix of people, 11 years. Tabitha says 3 years and dedicated. Tamala's dedicated. Sydney, thank you guys. Hi, Cecilia. She says whatever it takes. She's just like the jack of all trades. Yeah. Thank you all. It's nice to have everybody joining us. Hey, Sarah. Sarah says she's from the state office, and she was a service coordinator as a blended for 2 years, and also the local system manager. Glad you're here. Let's see, Jake here says she's 20 years and she lost count. Yeah, I'm in the same boat with you. All right, thank you all. So we have sort of a mix of blended and dedicated, and people with all different levels or tenure in your current role. So, all right, let's get on to our next question and jump in. Seth is going to be populating a poll for you all. What we want to ask you is, how are you currently providing service coordination services? Are you 100% telepractice, 100% in person, or a combo? If you all will take about 15 more seconds and get your answer in. All right, so it looks like we have about 13% who are 100% doing everything virtually. We have 3% who are doing 100% in person. And kind of as we guessed, we have 84% who are doing a combo of telepractice and in person. So that doesn't actually surprise us. That's what we were kind of thinking. So let's go ahead and get one more piece of information that's going to drive our discussions today. All right, what I would like to do is, Seth, do you want to jump in with directions and help people use their stamp tool?
Absolutely. We want to get everyone involved by using the annotation feature on Zoom. And if you're not familiar with that, you can take your cursor up to the top of your screen and you should see something along the lines of viewing options. There should be the option to annotate, and that'll pull up a menu. And there should be a button for stamps in which you can select what stamp you want to use. After clicking which stamp, you can place it along somewhere along the gradient here. And
If anybody has, go ahead, Seth, sorry.
Sure. I was going to say, and if you still have some issues, you can either chat your concerns or you can simply just comment your answer.
Thanks, Marissa. I see your comment. Yes. So we want to be sure we've given everybody enough time to participate. Take about 15 more seconds and be sure and get your stamp in, or feel free to put it in chat if you're having trouble using the annotate feature. All right, so you guys can see lots of clustering right around the Jessica, I see your message. It's fine. You're welcome to put it in chat and I'll grab your information if you would like to share with everybody where you fall on the continuum. But we see a pretty strong cluster right around the middle that I like some service coordination activities being conducted in person, while there are others that it's easy to complete remotely. So, Hooray, I'm going to ask you to get us started. How do you think your response matches what you think? Let me just really quickly first, Mallory's saying she's doing it from her phone, but she's right in the middle. She just wants us to know. So, Hooray, how would you respond?
Yeah, sure. So just to kind of talk about what we are doing in here in Fairfax County. So just like most majority of people answer, we are providing services in a hybrid mode. So, as a program, we are offering in-person services as a primary mode of service delivery, but telepractice continues to be an option for families. So, depending on the family's preference and their situation, this is still an alternative for the family. And personally, I really like, doing my work in combination of telepractice and in-person services. So if you think about, how to provide, quality service coordination, it's really about, tailoring our services and responding to the individual needs of the family, and having both options of telepractice and in-person services definitely gives me a greater flexibility to do that, to individualize my services to reach all family. So I definitely like having both options.
She falls right there in the middle with
Right
the
in the
most
middle,
of
yep.
it. Yeah, thanks, Ray. So before we leave this screen, up at the top of the screen where you had your annotate features, be sure you hit the little red X, and that will prevent for you accidentally continuing to stamp. While we love seeing your stamps, but we'll go ahead and close out of that. And let's move to our next question. We want you all to think about, we're going to pop up a poll in just a few minutes. When you think about the early intervention process, what do you think are the steps in the process that are most conducive to telepractice? And you can pick as many of these as you want. Just feel free to jump in which ones you like. Again, if anybody's having any difficult using the poll feature, feel free to put it in chat and I'll try to monitor that as well. I see people are still putting in, so take about 15 or 20 seconds to finish your poll. And Seth, can you share the results with everybody, please? What's really interesting about this one is that you all have, there are some things that people really felt strongly. And then again, we had people in the middle. So let's take a look for the intake process. About 55% of you thought that could be done pretty effectively. Same thing with eligibility determination. But for assessment or assessment for service planning, which is a Virginia term, 13% thought that could be done. IFSP development, 35%. IFSP reviews, really high, 87%. IFSP implementation or service, the visits, was a much lower number. People did not think that it was as conducive. And then transition, 84%. So thank you all for participating on that. Adriana, what I'd like to ask you to think about is, I know that you've talked about how your program has really tried to streamline some of the documentation or the paperwork process for service coordinators. So what have you done that has supported doing some of that through Telepractice?
Sure, Corey. It definitely has been a long process, and we have accomplished a lot and continue to accomplish a lot with all the efforts from everyone. I think definitely the first step was to make sure that we had a reliable and a HIPAA compliant platform to provide services virtually for families. So we continue using our Microsoft Teams platform, which definitely allows us to conduct productive, efficient, and smooth meetings with families and other team members. In terms of paperwork and documentation, we have been using, luckily, before the pandemic, a database that has allowed us as a service coordinators to keep track of our EI case management activities and our documentation. So service coordinators are able to run reports and enter documentation remotely. We also had something called forms to fill out in the field. So we had preset electronic forms that pre-populated when we used to go to the family's home for the families to sign. And that's when we encountered the issue of obtaining the signatures and a consent from families when the pandemic started. So we identified a system called DocuSign that offers the capability to obtain electronic signatures. The documents are encrypted, and it conducts a complete audit trail that is maintained and helps service coordinators to keep track of it. It allows service coordinator to send documents to different parties at the same time that need to sign the document. The system also sends reminders to those people who need to sign the document. And when the document has been signed by everyone and is completed, the service coordinator is able to download it and have the electronic signed copy and ready to store. This definitely was a team effort. A group of service coordinators help us identify the system, identify the features, and help us provide support and train the other peers and ITC staff. And we continue to learn new features of the system that help us streamline our process. And when I mentioned about storing records, then we moved to a third database, which help us to store these records electronically. Before, we used to come to the office, print those documents, file in a blue binder. So now what we're doing is storing these records in a filing system called OpenText. It helps service coordinators to keep the record organized and accessible to them and other providers as well. Then they can be accessed remotely. The system basically creates a folder for the child, and with some dividers or tabs when service coordinators are able to file or store or save, whatever we want to call it, initial home visit documents, rights and safeguards documents, IFSP, family co-share agreements, all this information will be accessible. So as you see, I have talked about 3 different systems. We definitely have the process for us, but we are very hopeful that Track It, the new state data system, is going to help us to bring this all in one and help us streamline the process as a service coordinator. Definitely most importantly is we continue providing the support to our teams remotely using different virtual platforms and using these electronic systems.
I think one of the things, if we think back over the past 2 years, when we first started this, all of these things had to be figured out. We weren't talking about virtual platforms and how to be able to do anything electronically. And Fairfax has really come together with lots of different opportunities that service coordinators can do things electronically. Adriana, we do have a question from Maya, who's in Washington. She wants to know if you could put the name of the software you use to run reports and enter documentation. Maybe if you could type that in chat.
Type in it, I'll do that.
That would be really helpful. And then Maya, feel free and first of all, I hope I'm saying your name correctly. But if I didn't quite get your question, let me know. Do other folks have questions for Adriana that you would like to ask her? Feel free to type those in chat. But I'm going to ask, Adriana was really sharing that kind of from a program supervisor, a service coordinator, supervisor kind of role. But Hooray, I know that when we were talking about our discussion today, you shared an example about an IFSP review with a foster family, and I'm hoping you might be able to share that information with our participants.
Sure. The story I share with you, Corey, I think is a really good example when conducting IFS reviews via telepractice was really helpful. So I have a child in my caseload who is in foster care. And it is a pretty complicated case because both the foster family and the biological family actually live outside of our program's jurisdiction, so outside of the county. In addition to that, there are multiple outside caseworkers and 3 different early intervention providers with a total of 9 different individuals supporting this child. So for this particular family, we've had a lot of concern with the child where in addition to the required 6-month and annual reviews, we had to end up scheduling multiple other reviews. So, if you imagine trying to coordinate all these meetings with 9 different people is very difficult. So I think had we not had an option of telepractice, it would have been really hard, especially very stressful for the family to complete reviews because they needed to actually drive out a far distance to get into a county building. And that's the only place we could do the review because they were living outside of the jurisdiction. More importantly, as a whole team, because there are a lot of people involved, we really utilize IFSP reviews to maintain consistent, up-to-date communication among all team members and family. So, if we didn't have the telepractice platform, I don't think we could have supported the family as well. Because I think if we had to meet in person and that was the only option, we might have ended up scheduling less meeting because it's really hard to coordinate, or not all people could have participated in the important conversation. So having that option for this particular phase was just really, really important in providing quality service and just really supporting this family. So I think it's a really good example when, telepractice reviews were really nice to have.
And, I think from our poll, we saw that a lot of people thought that reviews was a great step in the process, that we could do that. One of the things that you touched on that makes me think about as someone who thinks about budgets too, is not having to have people all trying to travel to get to a central meeting. You don't have to pay that transportation or whatever the reimbursement for travel time. So, and we also know, because we're living our worlds like this, you often can do more things in a shorter amount of times because you're not trying to get from point A to point B. So thanks for sharing that, Hooray. We wanted to move next to have you all thinking about what do you think are some steps in the process? How would you answer that question that I just threw to Adriana and Hooray? What do you think is now best conducted face to face, and why? So take a minute and type that in chat. Jessica says assessments. A lot of families have shared they like telehealth for intakes, IFSP assessments, reviews, because it's more conductive to their schedule or work schedule. They can have the review during their lunch. Julie says IHV and assessments because it's valuable to see the child in person. Jessica thinks that assessment for service planning is better conducted face-to-face. Somebody tell me the acronym IHV, is that initial home visit? Is that the
Correct.
acronym you guys use? Okay, that's
Yep.
what I thought. We called it the intake, but I thought maybe that's what lots of people are saying. Assessments are better face-to-face. Ongoing services, IFSP development. So we kind of have all over, people feel differently, but definitely I'm seeing assessment visits kind of being a recurrent. Maya, ASP is assessment for service planning. That's a Virginia term. Virginia does not use the word evaluation, but probably in your state, evaluation and assessment is a Virginia. So ASP is the acronym you're seeing. Thanks, Tabitha helped with that too. Let's see. Hi, Samir. Samir says ASPs. Mallory says intake and
Hey,
assessments.
Corey, how are you?
I'm good. I'm
good to see you.
Yes, thank you. I'm glad you're joining us.
Thank you.
All right. So, Blanca, we kind of have people feel pretty differently, but I see kind of a trending theme that assessments, visits are better face-to-face. Some people feel like they get more information when it's in person. Tell me what you think about that. What your feeling is on that.
Yes, Corey, I have to agree. I think that initial intake visits and assessments are best conducted face-to-face. I personally like to conduct initial home visits in person because it's the first time I'm meeting with the family. I'm making that connection, I'm building that rapport, introducing the program. And I also feel like it's easier to have a virtual meeting in the future if needed or if the family chooses. And that's because we've established that first connection. We had that good old-fashioned in-person contact, and that allows me to get a better picture of the family dynamic, the child's environment. And on a few occasions actually already, I've had to move an in-person assessment to a virtual one because of an unexpected illness or weather-related closures. And it's been very helpful to have that initial contact with the family because I was able to provide my observations and give the team feedback. And that was because I met the family in person. And there's no doubt that telepractice has been and continues to be a valuable tool as we navigate the challenges of the pandemic and continue to adjust to COVID-19 protocols. But I just don't think it will ever replace that face-to-face interactions, because as human beings, we are naturally social creatures, right? We want to have that social contact and those social cues, body language, eye contact, all those in-person human interactions and communications are so critical.
Yeah, I would definitely have to agree. I think everything that we're hearing about Zoom fatigue or Microsoft Team fatigue. I mean, I think we're all experiencing that. We actually had a conversation before we started our call today. We're not used to seeing ourselves. It's a little bit disconcerting to constantly be seeing yourself on screen and, how you use your hands, what's your face like. We're not used to that. And that's what this environment has done. But what I'd like to ask our participants, you guys pick the steps on the process. Is there anything else you would add why you particularly like some of those steps face to face? Anything you want to add to what Blanca said? feel free to type that in chat and I'll try to capture some of what you're sharing. I want to give you guys just a few more minutes, a few more seconds. There we go. Thank you, Marissa. She says, I like doing intakes virtually. Lost your thing because I get to see the child acting like themselves in their house when I visit in person. Thanks for getting us started, Marissa. Let's see. I saw one from Julie. I think Julie says seeing their child in their natural environment. Yeah, sometimes they act differently. You know, there's a funny saying that Brothenbrenner said about assessments, and it's something like it's the unusual act of bringing a child into a strange room with strange tools and strange people, and then trying to make some determinations about what the child when nothing's familiar. So I would agree with you on that. Jessica says she likes doing the intake visit both in person. Oh, she likes both and telepractice. From telepractice, she says I'm not disrupting what the child is doing and how the child is interacting with their family and with their toys. And her impact on the natural environment is minimal. I like that perspective. Melissa says seeing the natural environment also helps with goal development and services. Yes, thanks, Melissa. Hooray, we're gonna move on to the next one, and I want you to help us think through if you think pre-COVID, what did you find most valuable when you were able to see families face to face? Or another way to think about is what do you miss not getting to see families face to face?
Yes. What I miss the most, and I think this is something Blanca shared earlier too, and what people are sharing in the chat, is about, being invited into the family's physical space, their home, their natural environment, and how I could personalize my, interaction with families face to face. So if I think about, establishing relationship with family telepractice, I think I can do that really well on a virtual call too. But I think they're just things that we can only learn about the family by being present in their physical environment. Because when we are on a virtual call, we are still limited to what parents are reporting to us directly, or even just the video, kind of how they're working the camera, what they want to show us versus me being there. So as I'm talking, there's informal information that I'm gathering just by being in that physical space. So I think I definitely miss that, especially for families who I found, for them, telepractice is really challenging, or families who are kind of less transparent with information sharing. So they only share, okay, this is my concern, but not much more than that. And I felt somewhat distant from those families because, I'm not in their environment to gather other information. So I just want to share few examples of the families that, when I said, I really miss being there face to face. So I had a family who's the grandma who was in her 70s. So she's much older. She was a legal guardian of the child. So before the pandemic, and this family had a lot of needs and needed a lot of hands-on support. I used to do my contacts in person because it gave me a chance to go in there and talk to grandmother. And she opened up much more when I was talking to her face to face. In addition, I could also be there to kind of check in with the child just to make sure that she is safe, there's nothing wrong with her, that she's healthy. But, I couldn't do that after, we started going virtual. And grandmother, her kind of interaction and communication with me changed, that she stopped communicating with me. And afterwards, she told me that, telepractice, technology is really challenging. Also, she didn't feel like it was personal to her, like she felt distant from me. So even though this is a family that I had a really good relationship with, after we went virtual, that relationship changed a little bit. So I think that those are the families that I wish that I could see face to face. And one more example I have is about service coordination only children. So these are the children that come into our program and, after the assessment, they decide not to receive services. So they don't have ongoing therapists working with them. So it's really important for service coordinators to gather information about the child's progress during our context. And I had this particular family that as a team, we had a lot of concerns for the child, but parents, they were kind of in denial. They didn't believe the child had any, problem or, nothing, the delay was not too concerning. So they chose not to receive ongoing services and they just wanted to receive service coordination. So for my quarterly contact and 6-month review, it was very critical for me to see the child and gather information about the progress. But every time I connected with the family virtually, they were very hesitant to show me the child. They just wanted to talk to me. And when I asked, oh, can you kind of direct your camera towards, the child playing? They were really hesitant. And when they did, what they were showing me about the child was very limited. They would give him a book and then sit next to them. And that was it when I wanted to see more. So what happened to this family was after the 6-month review, parents, share that there's, we don't have concerns anymore. And they reported all this progress with the child and they declined services. So with this particular family, I really wish I had a chance to be in there face to face, that in addition to what parents are reporting, do my observation. And that was very limited in a virtual platform. So I think, thinking about telepractice, it does work, but I think it's not necessarily type of service. One service is more conducive to telepractice, but more that individual needs of the family that we decide, okay, face-to-face work versus, telepractice services.
Mhm. Yeah, so I think that everything, as we've talked about this, there are pros and cons. Of all of these kind of things. It's interesting as someone who provides professional development for brand new service coordinators, and they come to our training, and they literally might have only been a service coordinator for 2 or 3 days before they come to the training. And one of the things that they ask about is, how do you establish rapport through a video, through a camera? And Kim mentions in chat that pre-pandemic, she never would have thought that you could get as much good information, but that is a skill set to be able to see what's happening on the video, to simultaneously be conducting conversation and pulling all of that. So she says she was surprised at how much she is getting, but she also knows that wherever she is face to face, that having to wear masks and ask parents to mask in their home, whatever her policy is in her agency, can impact that too. So Kim, thanks for sharing that example. Blanca, anything you want to add, or a story that you might have thought of to think about? What do you value about face to face?
Yes, very similar to Hooray. I have many families on my caseload that experience high needs and many barriers. They don't have easy access to technology or even own a laptop. So during the pandemic, it was very difficult to troubleshoot tech issues remotely, and just not being able to serve these families in person was very challenging for me. So those were the times that I really missed, just being able to set up an in-person visit to best support the family. And when we were completely shut down, I did have one specific family where mom just had such trouble connecting. We weren't in the homes just yet. So luckily there was a nice day where the provider and myself, we were able to get out there and go see her and have an outdoor visit to troubleshoot these issues. And unfortunately, I wasn't able to figure it out. It was beyond me. Mom's email was locked. We created a new one. That didn't work. So thankfully, we were approved to use a different platform so mom could connect moving forward for sessions and services. And the PT was just so excited to be able to see the child finally and get to observe the progress and the gross motor skills, since we had such difficulty connecting with her. So I had a lot of families initially. It's gotten better now, but just at the start of all of this, it was so hard because of their resources and just their skill level with technology. So those were definitely the times that I was struggling.
Yeah, I think one of the things that we continue to hear is that there definitely are, you have, Hooray and Blanca, you have both hit on some equity issues about trying to do virtual or telepractice. Hooray's example was kind of ageism. Somebody who was elderly, that technology was not something that she was comfortable, and she felt like she wasn't able to have that rapport that she had already developed. And Blanca, the examples that you gave might be because of socioeconomic access to technology. I personally live in a very rural area of Virginia. We don't have high-speed internet where I live. It's just not available. And those are equity issues that we're constantly having to work on. Let's see, Marissa said, I used to go on visits along with therapists and see what they were working on and progress made. And she really misses getting to have those joint visits with therapists. So thanks, Marissa. Well, thank you all for sharing your ideas. And Adriana, I want to ask you the next thing. You provided us with some great quotes from families that we're going to show in just a few minutes. But as a service coordinator, supervisor, I really want to think about what feedback are you hearing from families now specifically about services being offered telepractice. And you might even have some families who knew the old way where everything was in person, and then we convert it to everything being virtual. So what are you hearing from those families? And Seth, if you can move to the next slide so we can see some of those family quotes, please.
Yes, before the pandemic, and we continue to do that, we gather feedback from families about their assessment process. So the quotes on the screen, I think the meeting was only limited by the virtual format. Everyone did an excellent job, communication and listening. Those were feedback that we collected May 2021. So it was a little bit, a year after the pandemic started. I feel as though we received just as an attentive and thorough assessment as we have had it in person. I have others. I mean, I don't have a specific data about feedback from parents who received face-to-face and then went to telepractice, just because the data that we are collecting is just after the assessment. So during these past 2 years, I'm going to say a year into the pandemic and a half, we basically completed all our assessment telepractice. And we recently moved into the in-person in the center. So some of the other quotes from families, and this was, I'm going to go back to November 2020, it was challenging doing an assessment with video conference with a toddler, but I think the team did a great job adapting to this new format. And that was already November 2020. So that was already what, 8-9 months since we started. I think everyone has done an amazing job during these unprecedented times. It is not the same as in person, but it's the best thing. That was May. That was also November 2020. Another recent one, the virtual experience was smooth, effective, and supportive. The team was very helpful and friendly. This is another one. I was initially very uncomfortable about the idea of doing the assessment over the video, but it went much better than expected. So I think we are doing our best in trying to accommodate to the circumstances. And as Blanca and Hooray have mentioned, definitely to the unique needs of the family. So that has been probably our main thought. I can share actually from the referral point perspective. So all those families entering our program, is that in-person services is something the family are really looking forward to receiving when they enter in our program, especially the services in the home. So we're currently providing certain services in the home, like our initial home visit, IHV, our services, but our assessment planning for service planning continued although in person, continue to be in a center. So families need to travel or have transportation to go to the center to do the assessment. So I do have to say that telepractice brings advantages to families in terms of scheduling, having parents participate from different locations, like Harry and Blanca have mentioned, parents from or other team members who would like to join the meeting. So we're hoping to continue to accommodate to what is best for the family, but really focusing on the needs of individual families while we follow our Part C and Medicaid guidelines. I mean, we do also have that part that we need to take into consideration. So hopefully we find this happy medium where everyone is able to be served with high quality service coordination.
Mm-hmm. Well, it sounds like you've gotten some good feedback, and I really like that you're collecting this data, and direct quotes are always so powerful to be able to hear what families are saying, and then giving you a launching point for how to respond, what could work better. I'm wondering, Blanca and Ray, you both shared some great examples. Is there anything else that you're hearing from families, or any others that you would like to share?
Yes, I'm definitely receiving positive feedback with the telepractice option. Like Adriana was sharing, for the most part, most of my families are preferring that in-person delivery option, but they like that virtual option to fall back on and utilize as needed. And I've had quite a few families where I'm seeing a true combination of both, and maybe they're requesting or changing an in-person meeting to a virtual one due to illness, scheduling conflicts, or other demands in their lives. I also like that families have this option because it could benefit their specific situation at a given time. And I currently have 2 families that are completely virtual, going back to what we were discussing previously. I think Kim mentioned in the chat that pre-pandemic, I would have never thought that this would work virtually, but with this one specific family, she started when we were shut down completely, and she has declined in-person services all along, even as we reopened and resumed face-to-face services. So when I held the IFSP review, I checked in again, and Mom declined in person. So during the annual, I really had the opportunity to witness the strong virtual bond that the family had with their provider. And the speech therapist's cat joined the annual. And it appears that the cat is a frequent guest during speech sessions. So the child loves it. It's the highlight. And you know what? That's okay. This is what works best for the family, their comfort level. And I was really happily surprised at their virtual bond. So it can work, and it has been a positive experience for this family.
Thanks, Blanca. Hooray, before you jump in, there's a question. Let's see. Maya says, does Virginia require that agencies offer families in person? Can an agency provide all virtual services? I'm going to take a stab at that, but you all respond differently. Maya, it really is all over the place. Virginia is a commonwealth, which means that local autonomy is a very strong push in Virginia. So we are following CDC guidelines, but agencies do have the option to determine how they're providing services, which is why when you saw the poll question, it kind of was all over the place. We did have a period where everything was being done virtually when the pandemic was really, really at the peak. And now each agency is kind of determining if they're doing a mix. We do not have too many that are 100% back to face-to-face. Service coordinators that are helping me with this, anything you would add, or did I cover that pretty clearly? I'm seeing head nods like,
Yeah.
Adriana, you think I hit that okay?
Yeah, I think you had it right. As I mentioned before, we do follow Part C and DMI's guidelines, and some of the Part C requirements provide some of these services in person. So basically, if that's one of the guidance, what we'll do is we'll adjust it based on any CDC guidelines right now, based on the public health emergency. But yeah, that's an expectation to provide some of the services in person.
And I just put in chat, DMAS is what we call Medicaid.
Medicaid.
Again, for people from other states. Hooray, did you have anything you wanted to add to?
Yeah, so just kind of to add on to what Blanca was saying about feedback that we receive, I've actually had a couple of families that experienced early intervention before pandemic for their older sibling, and then came back to our program during pandemic for their younger ones. So they've experienced kind of our service coordination being done in both platforms. So two of those families, and they've given me two different feedback. One family, the parents have commented on several occasions that they wish they had a telepractice option when the older child was going through our program. The reason being, the mom was working at the time, so she was always in her office, and dad was in charge. So he was the one that participated in the, ASPs and reviews. So mom's like, oh, if I had a telepractice option back then, I could connect them from her work to join and be part of the EI process. So this family, even though they value face-to-face, meetings, and they do like face-to-face therapy currently, they really like having that additional option of telepractice. And I think that's what Blanca was sharing. It's really valuable to have that option. But I did have another feedback from similar family, going through our program at two different times for their sibling. And this family, this mom was very against anything virtual screen. So she doesn't allow any screen time in the home. So she didn't like the fact that during therapy and our meeting that she had to be in front of a screen to connect. She didn't want that her children seeing her in front of the screen. So this mom actually declined all services because she just absolutely didn't agree to any telepractice services. So as you can see, we're going back to, both families, similar situation, but depending on the family priority, their culture, one really likes telepractice, the other one, not so much.
Yeah. But I think it's so powerful. And Julie mentions in chat too, what we are offering is family choice, family preference. And that's one of the things that I'm hearing, at least in Virginia, that most providers saying, we hope that continues to be when we get to the end of the pandemic or the health emergency governor kind of executive orders, that having families continue to have that choice is would be a really nice option. Heather's agreeing with that. Tabitha says our locality isn't there yet, so they're still doing most everything virtually. And she thinks that her next phase. So again, Tabitha, I'm not sure, are you in Virginia? Just because we have people, Marissa says, Tabitha, feel free to put that in chat. Marissa says families are more likely to participate if they're offered choice. And the thing is, so much of that is what is what early intervention is about. The family kind of helping to drive that process and having that choice. Tabitha says she's in Arlington. Thank you. All right. Thank you, guys. What I want us to think about, I'm going to switch gears a little bit and think about what support service coordinators need to help with their productivity, to be productive, and what supports do they need from their supervisor. And then we're going to talk a little bit about what supports they're needing among their team, because what we know is that people are not having those opportunities to meet with their team as frequently and that face-to-face. So Adriana, I'm going to throw this one to you again as a supervisor. What have you noticed for the service coordinators that you supervise, that what they might need or how you've responded?
Sure. Definitely what you just mentioned is that support from not only the supervisors, but their peers is key. And we are seeing this a little bit more now that we're coming to our offices for our activities. The other thing that we have identified is they need time to adjust to change. They need flexibility to adjust to these changes. They want to keep engaged. And as you mentioned a few minutes before, is like how we're getting a little bit of Zoom fatigue and all these things, and how we can keep them engaged. And I think one of the key things is that they're looking for processes and procedures that facilitate their job and that make their day-to-day easier and more manageable. And that's what we're hoping Tracker will help us with that, because as I mentioned, we're dealing with 3 systems that are very efficient and help us a lot, but it's a lot to handle, and I can acknowledge that. So what the supervisors as a team we have been focusing on is definitely identifying and knowing those employees' strengths. I think that's key for engagement and teamwork. Is anything, any goal that has been set, trying and aiming it towards those strengths to help the staff or the person navigate that change. Discuss with the employees what they need and also what they bring to the table during these times of change. And yes, we changed the systems. We changed to 3 systems during the past 2 years, and the pace is different for everyone. So we focus on 3 different main things, and one I think I already kind of like grasp on it was individualization. Is really looking at individual staff, the conditions that allow them to do what they do best, right? Understanding what where the employee performs best, providing flexibility, coaching, those one-to-ones with their supervisors, where they're able to talk about any challenges, successes, challenges with the workflow, and definitely for us to be able to provide the technical administrative support, but also the emotional support that might be needed. The other piece is accountability. I think setting clear and collaboratively expectations with the staff and each person is key. So they are able to identify what success means for them based on her talents or their talents and strengths, come up with achievable expectations that they are able to monitor themselves, that we have metrics or monitoring reports that can share with them, and providing feedback. I think that's key. Open communication is my last one. I think one of our most important. We have encouraged our staff to having these open communications with the supervisor to identify the supports that are needed to meet the expectations that are also expected. And yeah, clear and early expectations. I think that when everyone works best when they know what is expected to do and what supports can be provided.
Yeah, I think Adriana, and I actually put it in chat when you said it, I think that recognition that change is hard and time and flexibility is just so crucial to through all of everything that we're doing, because so much has changed. Let's see, Kim was saying that she really likes the option if a family has to change from in-person to virtual. And we talked a little bit about because of maybe they didn't pass their screening, maybe they've traveled, maybe their child is sick. So those are good options. Let's see. And Maya's asking, and you know what? I cannot say that I can say I am not sure I know this answer. So I can find this answer, or if somebody knows it, please help me. She's asking, is it allowable for a provider to refuse to do in person in their agency because of vax, because of their personal health risk? I'm not sure of that answer to that. If anybody knows, please help me put in chat. Otherwise, at the end of this, I will get that answer and shoot it out to you guys in an email when we're finished. I'm looking to see at my presenters if anybody is answering. Marissa says, I think it depends on your locality. Seeing some. So I'll get clarification on that and see if I can get that. Let's go ahead. I'm seeing that our time is running a little bit short. So let's wrap up. Sarah from the Part C office says it's up to the locality. So Sarah, I'm going to use you as the Part C voice. Thank you. So what supports do service, whoops, sorry, next question, sorry. How are you all supporting each other on your teams during this pandemic and during all these changes? Go ahead and put that in chat for me.
Somebody posted in the chat, Corey, how they can get great support from peers and supervisors virtually as well when we have group chats. So that's an instant response to questions. So that's very helpful.
Yes, thank you.
Yep.
And I feel like I get more support that way. Thank you.
Mm-hmm.
You all feel free to keep adding if there are things that you're doing to support each other. We are almost to the end of our time and work hard to really honor your 1 hour that you've committed to us. So I want to be sure I have time to say thank you so much to Adriana and Blanca and Hooray for sharing all of their expertise, their stories. Thank you all for joining us and sharing what you know. So we hope that you will plan to join us for our next service coordination chat. I do know that it will be held in May. And if you're on our mailing list, you will get that information. I am unsure about the topic right off the top of my head. So stay tuned for more SC chats in 2022. At the end of this, if you registered for today's meeting, you will get a survey. When you complete that survey, you will then get a certificate of completion for 1 hour of professional development. And Adriana and Blanca and Hooray, I want to thank you again. I hope that you are seeing the comments, that people really enjoyed the dialogue and the conversation. So we really appreciate you taking your time and spending this hour with us. Everybody have a great afternoon and hopefully we'll see you in May. Thank you.
Thank you for inviting us. Have a good day, everyone.
Bye.
Bye, everybody.
Thank you.